guys, I decided I'd create this video to talk about what just happened to me today. I was not attacked by a bunch of red fire ants, is what it may look like. Rather, instead, what happened is that I got an follicular unit extraction service done over at the Hair Science Center in Denver, Colorado. And it's from a Dr. James Harris. He's a very reputable doctor. It's someone who I trust and someone who I'd get a procedure from again if I ever needed another hair transplant. But my decision to get the FUE was because I wasn't quite satisfied with the density of my hairline, and also I wanted to get a little bit lower. However, I don't mind, and in fact I prefer having a slight amount of a widow's peak. I think it kind of looks alpha. You think like Vegeta from Dragon Ball Z, that kind of thing. Like the alpha hairline usually has at least a slight bit of a recession, but nothing stupid looking. So that's the reason why I got it done. And I figured I'd talk a little bit about my other option, which I neglected, which was a follicular unit transport. Or, which is, I think that's what the acronym stands for. But anyways, that's the one where they take like the strip method, they pull like a piece of meat off the back of your head and everything, and they like chop it all apart when they plug it in your head like that. The difference between that one and the follicular unit extraction, where they just take it all individually like that, so it's not nearly as invasive. I mean, if I got the FUT, I'd still almost certainly be in the hospital right now, in the recovery room, and I'd probably have to miss at least a week of work or so. I have a couple days off, so I don't actually have to start working until Thursday. And I need it because I'm still pretty hopped up on Percocet and a lot of other drugs. But yeah, anyways, what happened, the procedure took about 8 hours or so, which wasn't bad for 1,000 grafts. And unfortunately, I can't work out for about 4 days. And I can't use minoxidil for about 4 days either. And having had one of these procedures before, I know results don't actually start to come in until about 3 months, and even then you'll just start to see like some spuds pop up from your hairline, or wherever you got wherever you got like the hair plugged in. And so it's going to be about a good 6 months before I reap the full benefits of this procedure right here. So comparing the FUT versus the FUE, the FUE is quite a bit more expensive. The grafts I got were $8 per graft. If I were to have gotten an FUT, it would have been about $4 per graft. So I would recommend getting an FUT, just sucking up and going for the big procedure. If you require more than 2,500 grafts, which probably won't be necessary unless you're a Norwood 4 or greater. I was about a Norwood 3 before like this whole like hair loss thing began. Now I'd like to think maybe I'm like a Norwood 1.5 and Norwood 2 of the worst. And that's fine with me because, I'm in my mid-30s and I don't have to worry about like having a teenage head of hair again. I just want to make sure that my hair doesn't make me look like a complete asshole. So if you if you require a really, really big transplant like that, then you get an FUT unless you're like insanely rich or something like that. The other downside with the FUT is that it's going to leave a big-ass scar in the back of your head. Now, you can't actually see the pock marks that would appear because I still have the bandage on the back of my head and I have to leave it there for a day. But you do get small little pock marks, which are barely noticeable when you get the FUE. And other than that, it's pretty unnoticeable. So with the FUT, you pretty much have to keep your hair at a certain length. Otherwise, you won't be able to like hide the scar. And of course, another option is to get a body hair transplant, which is really expensive. I looked at it as about $10 per graft at the place I went to. And the big downside with a body hair transplant is that you can't actually grow it the same length as the rest of your hair. So if you like a long hairstyle, tough shit, you have to keep it short for life because there's only a certain length body hair can grow at. And also, the texture isn't quite the same. So if you're one of those really unfortunate individuals who doesn't have enough donor hair, and that's something you probably won't have to worry about unless you're at least a Norwood 5, 6, or 7, then you'll have to consider either a body hair transplant, but even better, if you're willing to do it, is a facial hair transplant. And if you hate shaving, that's a great thing because they can take care of all that hair and you don't have to worry about shaving ever again. But of course, if you like to grow a beard, then you'll have to either decide what do you want to keep, your beard or your head hair. And the good thing about beard hair is that it actually does grow at a similar length to head hair, and the texture of beard hair is very similar to the texture of the hair on top of your head. So yeah, you can see I have a pretty lumpy head right here. So that's what I explain to people when they tell me I should just shave my head, is that not everybody has like the head structure to pull it off and everything. And when you're someone like me who works with a clientele, you have to maintain a professional appearance. So it's just really not a viable option for anybody. But yeah, I'm glad I did it and everything, and I'm really, really excited about seeing those little spuds pop in. And as for my current drug routine right now, in addition to the pain-killing medications, all I'm using is finasteride and minoxidil. I've dropped RU58841, I've dropped stemoxydine, I'm not using Nizoral, but I still have those on reserve in case things start shedding again. Like, the weird thing about me is that I start to shed a little bit more severely towards winter, so that's when I'll probably hop back on those drugs. And I even have dutasteride on hand in case I need it. So I have those weapons on reserve, but right now, and I think for most people should be able to maintain just fine with just finasteride and minoxidil. But yeah, okay, that's all I really wanted to say about this, and take care, guys.